I'm Dr. Sabrina Siegel with the Neuroscience Education Institute. Welcome to the NEI podcast. On this show, I sit down with renowned mental health care experts from a range of diverse backgrounds to discuss breakthroughs and best practices for treating patients with mental health conditions. Welcome back to the NEI podcast. Today, I have here with me Dr. Rona Hu and Dr. Napoleon Higgins, and I'm so excited to share this exclusive episode with you. This is a chance to have some of your unanswered questions addressed from our 2021 NEI Congress presentation on nurturing cultural humility in mental health care that was just presented by Dr. Higgins and Dr. Hu. Welcome, both of you.
Thank you so much.
Thanks. It's great to be here. Thanks for the invitation.
This question is for Dr. Higgins. You spoke about your white friend who grew up in Black culture. If he prefers the Black cultural identity, would he be accused of cultural misappropriation just because of his skin color?
Well, oddly enough, that particular friend, he never identified as being Black. So even though he grew up in Black culture and he's, Black school, Black wife, Black children in the Black culture his entire life, he's never identified that he was Black. He's always identified as being white. But even at that, I would say that I'm careful to use the term cultural misappropriation, just like I would see it as if someone said that because a person was a good student, that means that person is acting white. Just because you like, rap music or have been immersed in Black culture, I wouldn't call it a cultural misappropriation. Now, what I do consider cultural misappropriation is when you're using another person's culture for gain, especially when not giving credit to where you've received the information from. So some would say that even Elvis may have, some see Elvis as a person of cultural misappropriation in that he actually stole songs from Black artists who were never paid for the work that they had done in originally writing the songs, such as, Hound Dog, Jailhouse Rock, and several others, where he was paid or he was very popular because of his style of music and style of play that was basically seen in Black culture a lot, but never paid homage to the work that had been done before him versus, say an artist such as Eminem, who his fame is made through, rap music. But at the same time, he constantly pays homage to the artists who came before him who influenced the work that he does.
Right.
So I would be careful of using that term many times because it could be used, I would say it could be used both ways. But at the same point, you want to make sure that you're not in judgment of individuals of how they see themselves. So if you see yourself a particular way, it's not my right to say that is not you. Who am I to say that, regardless of your race?
Wow. That's great. That's a great answer. Okay. The next question is for Dr. Hu, and it says, how can one become a better person and caring clinician despite all the racial and mental health disparities in our society? And Dr. Higgins, if you'd like to add on to this, that's perfectly fine as well.
Yeah, I'd very much like to hear as well what Dr. Higgins has to say. I think the key is to remember that we are the sum of our actions. And so becoming a better person isn't a one-time decision. We're like every day. And the question asks about, despite all the racial and mental health disparities in our society, it's like, yes, if we give up, then we're not helping. So to keep doing and to perhaps do it imperfectly at first, but everything that helps.
Right.
And I would say, you've got to have an interest in your community and the people around you. So by even asking the question, I think the question is answering itself, that I want to be a better person. I want to be a caring clinician, and I want to work through any biases that I may have and also the biases of my colleagues. So, in order to decrease mental health disparities, it really starts with the individual clinician recognizing your blind spots. There are certain blind spots that I have as a male when dealing with female patients, or even dealing with family members who are women, and dealing with my wife and my daughter, because I don't have the same experiences. So I have to say to myself, where are my blind spots? And if someone can show it to me and I need to be able to receive that, now I can do something about that now that I know better. So we have to look for the blind spots and be willing to receive that I'm a human and I continue to grow and I want to get better.
I love that. I love that. And I just want to address the fact that I love the title of this talk in that it's humility and not competence. And I think you both made such an excellent point about how, you know, we're always a work in progress to be better humans. And it's not like you just reach this level and then that's it and you're done. Right. So I love that.
I'm glad, Dr. Higgins, that you brought up, you know, we were talking about cultural humility, but in talking about gender disparities, you know, we're all learning as well. So the person asking the question, it starts with that. It's asking the question. It's like, how can I do better? You know, as I mentioned in my talk, I recently lost my father. And at 90, he was still asking questions and doing better. I remember when he was still teaching as a professor, he came home and said that his class had booed him because a woman had opened the door for him as he came in the classroom. And he said, you know, you're getting old when a co-ed opens the door for you. And he was like, what did I do wrong? And it's like, oh, Dad, you know, she was trying to help you and you disrespected her by basically implying that she was weak. And I said, you know, first of all, people can help open doors if the person ahead opens the door for someone who's carrying stuff. Those are all good things. That's just helpful. And then the use of the word co-ed implies that, you know, men are educated and women are co-educated. And it was a term he grew up with. But I always feel like if my 90-year-old dad can keep learning and evolving, then, you know, there's hope for all of us.
The next question is for Dr. Higgins, and this person says, do you have a book or resource that we can read more about Black history as written by the Black community?
I would say, yes, there are so many books out there, and I try to stay in constant, I guess I would say, readership, and that I'm always learning still about Black history and Black community and different and individual experiences that are occurring throughout the diaspora of, you know, throughout the African diaspora, which is people from Africa who've moved throughout the world. So I always find history to be stimulating. Honestly, I like to read other people's history as well. You know, so anyone's history is great. I love to know of my own even more. So one of the books that I read recently is called Before the Mayflower, A History of Black America. And someone had recommended this book to me for well over a decade. Actually, it was my eldest sister. She was like, you need to read this book. You need to read this book. And that was one that I read just recently that really made a huge impact on me. And then another book, I would say the one that made the biggest impact, I would say, is The Miseducation of the Negro by Carter G. Woodson. And that book was written somewhere around the 1920s, 1930s. But his, you know, and Carter G. Woodson is the father of Black History Month. But when you read, the book continues to be a bestseller because even though it was written almost 100 years ago, it sounds like it was written just yesterday about understanding the culture, the history of Black people in America, and why do you see the things that are going on right now, be it education, political, all of that is really covered in that book, and that would have the most profound impact. So I find that the books that make the most impact really depends upon where was I at the time mentally when I read the book and what it meant to me. And those are one recently that I just read in the past, say 6 months. And the other one is one that I read almost 20 years ago.
Wow. That's so great. Thank you for sharing that. The next question is for Dr. Hu. And this person says, there are many practitioners that don't want to be humble and understand because they don't think they need to understand. And they say, what is in it for them to understand? I think another way to phrase that is, why is it a good thing for them to understand? Why is it necessary?
Yeah. Because sometimes admitting that you did something imperfectly in the past, you know, it's a very understandable reaction to get defensive. We talked about how it does take a certain amount of energy to learn, but it also takes a certain amount of energy to be defensive. And when you really do understand, you'll be able to do your work better. You'll be able to help our patients better, because we all want to do that. And so I think that remembering the growth mindset of that we're all learning, and each time we do something a little bit better, that just benefits everyone. I think sometimes when people don't want to be humble or they feel defensive about it, they feel like things like racism and sexism, that it's like a zero-sum game, that that one group doing better means that another group will be worse. And it's not like that. It's not a ladder that that medicine or society is. It's a mountain. And so understanding each other, we can help each other.
Absolutely. Absolutely.
And one thing I would, add to that is, as Dr. Hu had discussed earlier during the presentation, the issue of denial being an immature defense mechanism. So in order to avoid growth, I dismiss the information and I deny that it occurs, despite it impacting my outcomes of the type of clinician that I am.
Right.
And we want to always be in the issue of growth, where we continue to want to learn, to understand people so that we can have better outcomes in treatment and care. Picking the right diagnosis and the right medication is just a part, if not a small part, of the overall treatment experience for the patient.
Wow, that's so powerful. I absolutely agree with that.
And even though it does take some effort to learn, once you've learned it, then that is something that you now have in your toolkit, that, when you understand something a little better, it's not like you have to jettison some other part of your memory bank in order to make room for it, right? You just do better. It's good.
Yeah. Yeah. The next question is for Dr. Higgins, but feel free to jump in, Dr. Hu, as well. When it comes to racism, how much have we been assessing for post-traumatic stress disorder?
Wow, I love this question. The fact is that racial trauma is trauma. And I have had patients who have issues with post-traumatic stress disorder and have all the symptoms from racial trauma. So this definitely does occur. I cannot think of the name of the rating scale, but I know that there's a recent rating scale trying to pick up racism as, that a recent rating scale that looks at racial trauma and its impact on the individual. So when it comes to racism, we must assess for PTSD. And I have many times where patients who are Black, who've been suffering from a racial trauma, want to come in to see a person who's Black because they believe that we'll understand that experience. And the majority, 95% of Black doctors or clinicians or therapists would be able to understand, at minimum, the perception that the person received from it. And that can be very embarrassing and even traumatizing when you're speaking to a person of another race who you believe does not understand, or maybe in the situation of denial that it actually exists, where you're having to explain too much, where you don't want to have to go through all of that for someone to understand what trauma that you may be dealing with.
Right. Okay, the next question is for Dr. Hu. And this person says, how do you deal with families that demonstrate inappropriate behavior that is not culturally sensitive?
I really like this question because the way it's worded, it's not specifically about families of patients. It can include your own family. And there are definitely there's definitely many strategies. There are probably times that you can just sort of call them on it immediately. And there's times that they probably won't react well if you call them on it as directly. So I have so many examples. I remember, and this also depends on whether the culturally insensitive behavior is happening to someone else, if it's happening to you, if you are of a matching background with the patient or not. I remember an Asian patient, kind of implying that with George Floyd and the demonstrations that happened afterwards was, it's not our fight kind of thing. And then this was a patient, I might have not done this with a patient that I had just seen for the first time, But, she was a mom of teenagers. And I said, did you see that video? Did you see him crying for his mother? And then she started to cry. And, it's okay. So maybe your teenagers haven't been pulled over, but, and I told her about a colleague who is, now a neurosurgeon, but when he was a student and studying late, he got pulled off of his bicycle by cops who thought he had stolen it. And, all of the kids who wouldn't have been saved had he been shot, because he could have been, for this presumed stealing the bicycle. It is all our fight. And that made a big impact, because I think it was easy for her to other people. It was easy for her to say it's not our fight. And I think if there's anything we've learned from history, I mean, in Nazi Germany, it was sort of like if you say, well, I'm not Jewish, I'm not a gypsy, I'm not Polish, I'm not, it's like, if you think they're not coming for you, you might find out differently.
Yeah.
And then, there's so many answers to this question, but I think realizing that there's more than one strategy.
Yeah. Okay. The next question is for Dr. Higgins. How can clinicians engage Black patients to help facilitate medication adherence and attendance to appointments? This person says, I understand the mistrust and I have tried to address it, but I still feel a lack of connection with some patients.
Well, the fact is that you want to make sure that you're thorough, that you listen, that you understand, and that you ask questions. As I had stated before, asking questions so shows that you're interested. And so you want to ask the questions and make sure that you give them the opportunity to ask any questions they may have. But the fact is that, just as the Black patient may fear that the clinician may not be doing as much as they should and hope to be doing, that also can come from the clinician themselves, where they feel like the patient will not do everything that they should. So you want to have an open understanding, an open dialogue. And obviously what you would not say is that, well, because you are Black and I'm white, I feel as if you will not take your medication or make your appointments. Obviously that would be something that you would not say.
Right.
But being open, honest, asking the question, and many Black patients will say, well, I've been looking for a Black doctor, but I have a great white doctor or Asian doctor or Hispanic doctor. And I tell people, if you're getting good care where you're at, stick with that good care, right? You don't want to change or switch because of that. So just trying to make sure that you have I would say you have the trust of the patient when you've done your job. You did you did the follow-up question. You listened to what was going on. You were thorough about the work you did. And most patients will recognize that.
Right. So we have just 2 more questions. The next question is for Dr. Hu. Can you give some language to use with patients from vulnerable groups, such as Asian patients or Black patients or Native patients, to give them permission to open a dialogue about their experiences?
Yeah, that's a great question, because it might not happen all at once. So I like the way it's phrased, to open a dialogue rather than it being like a one-time question. Even the insight of knowing that these are difficult things to talk about. So in terms of giving some language, having it be open-ended, if it's something like, have you ever experienced racism? That's a yes or no question. And even more than the words, I think that the eye contact, these days that might be on Zoom, but to express with your body language, a lot of times we're trying to type or, get our note done at the same time. Make it clear that you want to hear their answer, even if it's bad news. So if you're subtly shaking your head as you're talking about something that might be painful, then that's signaling that you maybe don't want to hear the answer if it's painful. And then a lot of times, if I think that they might have trouble opening up to me because of who I am, then I'll address that and So, within different Asian groups, a lot of countries in Asia have been at war with each other. Or, within the Chinese diaspora, they don't necessarily know what my background is, or my background might be one that, had difficulties with their people. So I've brought them up. I'll say, I wonder if it's more difficult to talk to me because of some of the history that, that our heritage have had difficulty with each other, and to be open and also to give them time. And so if they say no, not to just be like, okay, I asked the question and I'm going away.
Right. Okay, that's very good feedback. Thank you for sharing that with us. And that takes me to our last question. So it's for Dr. Higgins, but feel free to jump in, Dr. Hu. And the question is, do you feel that therapy would be beneficial if you're having difficulty letting go of the anger you have from the years of experience, macro or micro aggressions? And if so, do you have any recommendations?
Well, I believe that therapy is always good, regardless of the experience, but especially if you've been offended and if it's causing long-term consequences, such as the racial issues that they caused anger. I would also say that therapy helps, being able to talk to a good friend, having a safe space to vent. Too often when people face these experiences, especially when you're in a situation where you're isolated, where you're the only Black doctor there, that can be very difficult to have a safe space to speak about it. Not to mention that may not be a Black therapist to talk to about it. And it can be definitely re-traumatizing to go to other authorities at the place of work or even in your place of training, because the portion of it that makes it so hard is that you're new, you're a resident, you're a medical student, you're new on the job, and somebody has done something that is very offensive, but this is their peer. This is somebody who's been there for many years, who's well liked by the people around them. And you would assume that because I spoke up, that somebody would run to my defense. But that may not be the case. Actually, more people may be against you for speaking up or getting their peer in some sort of trouble or controversy. So going to see a professional about it definitely can be beneficial and helpful in sharing that experience with other individuals who may have gone through both macro and microaggressions. Recommendations, I would say having a good mentor matters. A good mentor matters whether or not they're in your institution or not, because many times you may not be able to find a mentor in your institution. But have even someone in the community or even at a neighboring institution can be very helpful in navigating that situation. I had another incident that happened in residency, and I'm not speaking poorly of where I trained at, in that these were, I believe I was well trained, and I don't believe there was any more racism there than anywhere else. But I know in having another incident, I did have a Black faculty member as a mentor who could speak up for me, who I felt confident in, who could say something. And it's amazing when a person is talking peer to peer versus peer to someone who is under them in their training. So by having someone to step in for me definitely changed the situation when I dealt with not the same type of circumstance, but something that I felt was a microaggression, and how it was quickly resolved without even me being in the room. So doing therapy, having a mentor, and being able to connect to individuals matters when dealing with these situations.
I agree with everything Dr. Higgins said. Therapy is beneficial for, in every situation. I think that we can have many mentors. We can have more than one mentor. And so you may have a mentor that matches you in some ways and not in others. And that's very helpful, and that it can be in lots of different directions, And then the way the question was phrased, difficulty letting go, I want to change the wording slightly to processing the anger that you have from years of experience, because letting go of the anger is actually, you have a right to it, and you have the ability to do something with it. So therapy helps you process that anger, and then having a mentor helps you process that in ways that then can be helpful for everyone, including yourself.
Absolutely. Well, on that note, I want to thank both of you for this fascinating interview. And thank you so much for taking the time to address so many of those unanswered questions that we just didn't have time for. It's been just an honor having both of you on this show. Thank you. And at this conference.
Thank you.
Thank you.
Thank you so much for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today.